Immediately, I responded to the WalkAide, and I was just so exhilarated and happy that my foot was actually functioning like it's supposed to.
Call it a miracle? I sure did.
I put this on the first time. In the first 5 minutes, it's doing what I can't. That's amazing.
When she runs is when I really see the difference. I've never seen her run so stable and so easily.
People say the term foot drop. Essentially what they're alluding to is the fact that patients have difficulty raising their foot. Most commonly, and this is what we're alluding to when we talk about foot drop, it's due to an injury to the brain or the spinal cord. And that's what's unique about WalkAide and these functional orthotics, is that not only are they compensating for the patient's deficits, they actually help with neuromotor recovery. I think it's incredibly liberating for a patient to get out of their big bulky brace a lot of times and be able to walk barefoot for the first time, be able to wear flip-flops.
We get feedback all the time from patients who tell us that this device has changed their life. It's allowed them to walk more normally. It's allowed patients with MS to continue in their jobs without feeling different from their coworkers. It's allowed patients that have had strokes to rehabilitate themselves. Some patients even have walked out of the WalkAide.
The WalkAide system is a highly sophisticated Class II medical device, available with a doctor's prescription only. WalkAide was originally developed at the University of Alberta, and after a decade of testing and refinement, it received marketing clearance from the FDA in 2005. As a result, thousands of people, both adults and children who struggled with foot drop, have found new freedom and independence with the use of the WalkAide system.
Kids or pediatrics are a lifetime patient, if you will. And if you can avoid one surgery or one additional muscle atrophying because of the use of our products, it's a win-win for everyone involved, the parents, the child, and ourselves, as well as the physician who's managing the care of that patient.
The WalkAide is very effective for treating foot drop for conditions with upper motor neuron lesions. Typically, you will always get a good signal because their nerve below the knee is intact. WalkAide gives people hope, inspiration, and a second chance at life.
The WalkAide is a dynamic treatment system that uses functional electrical stimulation, or FES, to restore nerve-to-muscle signals, prompting the foot to lift at the appropriate time. WalkAide enables more efficient walking for longer distances, on uneven surfaces, up and down the stairs, and even sidestepping.
You really can use this device on more challenging patients that have weaknesses in multiple joints, and if you just give them some time, you can really see some things that will just amaze you, that you would never be able to give with an AFO.
While AFOs, or bracing, may help to stabilize the foot and ankle in foot drop cases, they may not help restore a normal walking pattern, nor do they engage the existing nerve-to-muscle pathways. WalkAide, on the other hand, is very effective for treating foot drop caused by upper motor neuron injuries or lesions, and, as clinical research indicates, it helps improve walking speed with less fatigue. The WalkAide was cleared by the FDA for the treatment of foot drop due to multiple sclerosis, stroke, cerebral palsy, traumatic brain injury, and incomplete spinal cord injury. Currently, Medicare covers the WalkAide in patients with incomplete spinal cord injury only.
Because WalkAide is so highly effective in treating foot drop, I really don't see why insurance companies don't include this in their benefits package. The WalkAide device is an affordable product, and I believe for everybody. We were able to secure a payment plan that we worked out together with our orthotist that met our financial plans. I don't see the WalkAide device as a purchase. I see it as an investment. The happiness that I see in my wife when she's wearing the device and able to walk around. With an investment, you hope to get something back in return. My wife has gotten her freedom back daily.
If someone were to ask you, how much is it worth to you to be able to walk? what would you say? WalkAide is invaluable to me. I can't put a price on my ability to walk.
I was diagnosed with a spinal cord injury and was told I would not walk again. 6 doctors came walking in my room, surrounded my bed, and they told me that I would not get up again. After a couple of weeks of using WalkAide, I knew I could never go back. I knew my life had been changed forever by this device. You can listen to stories and you can hear about how well I did, you can hear about how well others have done, but it doesn't seem real until it's on you and you take those steps and you feel that sensation of just walking. Something I didn't even remember what it felt like. And it's neat to get back. WalkAide is my miracle, and I've seen it work miracles in other people's lives as well. For me, WalkAide truly gave me my life back.
Can I have a glass of water? Can I have this? Can I have that? Can you help me to the bathroom? And, you know, WalkAide changed that. So his independence has been a great relief to me because I no longer have to be here with him 24 hours a day, 7 days a week. Just imagine the fact that you can move around freely. There's no price you can put on that. And I know it's a little bit costly, but how do you put a price on freedom as opposed to being, you know, confined to a wheelchair?
You know, the doctors told us she wouldn't walk and she's doing ballet.
The WalkAide is worth everything to me. If my house caught on fire, as long as I have my WalkAide with me and my children's pictures, I'd be fine.
The WalkAide to me personally, it's priceless, you know, because it does so much of what I can't do.
As evident within this video presentation, the WalkAide is considered an investment in recovery and rehabilitation by its users. While WalkAide is occasionally covered by some insurance plans, the majority of WalkAide users opt to purchase the system outright to derive immediate benefits from the device. If you're ready to take the next step toward regaining your independence or helping a loved one do the same, you can now try the WalkAide for 2 weeks on a trial basis. Talk to your clinician or call the toll-free number to arrange for a WalkAide consultation. You'll be referred to a local provider to see if WalkAide is right for you. A short visit with a WalkAide trained clinician may be the start of a life-changing event for you and your loved ones. WalkAide. Independence. One step at a time.